As Professor Bhuvi rightly said, we live in a world of change and rapidly mutating diseases, a world in which equity and access to health services are lacking too often and for too many. We need the best evidence-based research for the challenges of today and the future, and it will be mainly up to the next generation of researchers to tackle them. Our next segment, which we have called A New Generation in Global Health, puts a spotlight on these challenges. We have invited 4 talented researchers from the 4 winds to share their perspectives on global health. They will also share thoughts on how we as a research community can contribute to health worldwide. I'm happy now to invite Aku, Shree, Dalila, and Conor to please take the stage and do the honors.
Good evening, everyone. It's an absolute pleasure to be here tonight. So the question that I was asked was, what did I see as a potential threat to the future of global health? And one difficulty I thought we might run into is perhaps after these many decades, we wouldn't have actually learned anything. So whether we see global health as having started 10 years ago, 50 years ago, or even 100 years ago, the fact is we have produced a lot of science, and we've come to believe that onward progress is the only option. And yet we know that even though we face new emerging risks, like new disease outbreaks, climate change, increasing urbanization, we still face problems that remain outstanding, like cholera, or like the plague. And what unites us at this meeting, I think, is our common belief that in our own modest ways, we each contribute to our various sciences for the improvement of human health. And yet we also know that even our best interventions sometimes go off script when they come face to face with our human unpredictability, our hidden motivations, our assumptions, and even our self-interests. Having started out in the lab, I can tell you that a successful experiment is not always the end. So we perfect whatever it is that we're working on. What then? What do people actually do with it? Because the science doesn't always trump society. And so once we begin to understand this, it can help us explain why progress stalls. And this is why I've come to love the study of health systems governance, which raises some of these questions, but also seeks to look across the spectrum of health action to understand where and why and how do decisions get made. What happens at the interface between science and society, and whose priorities matter. And so my message this evening is simple. In the 21st century, as we increase in information, connectivity, and people, how we learn will become even more important. In Ghana, we have a proverb which is depicted by a bird facing its tail and holding an egg. It's called Sankofa bird. And the meaning is, go back and fetch it. Or the literal translation is, it is not wrong to go back and gather that which we have forgotten. This is to tell us that history is important. Feedback is important. Having the humility to admit when we are wrong and have failed is important. And learning is important. And not just learning in technical or in academic ways, but learning why certain kinds of knowledge work or fail. We have to all learn within our sciences, across our fields, from the past and from other sectors too. As the international health community, we need to collectively go back and gather that which we have forgotten. We need to learn and learn in new ways if we're going to make real progress. Because the truth is, science will always be important, but on its own, it can never be enough.
Namaste and very good evening. With the Alma Ata Declaration of 1978, there was a great emphasis on the public sector in the provision of healthcare. But since then, the private health sector has grown enormously in the developing countries, and billions of people continue to seek care from there. We, in the developing country, we are at a situation where we have a weak public sector and a very strong, unregulated private health sector, which is very poorly connected with the rest of the health system. While the private health sector has contributed to the availability of the health services, it has forced people to pay out of pocket enormously. In this fragmented health system, patients are forced to move from private to public provider, causing important diagnostic and treatment delays. This system has been very discriminating to the poor and worked against the goals of access and equity. Therefore, I believe it's a time that private sector needs to be relooked closely. Nations in the Asian region have been making policy shifts towards universal health coverage, and most of us in this room work on that issue intensely. However, in our region, the effective policy responses from the government and as well as the developmental agencies have been hindered by the paucity of evidence from the field. We, as researchers, find many challenges to do research in the private health sector because of its messiness and complexity. There are situations where we don't find any data in the field, and the field realities are far from what we hope for. Some circumstances where we have to make a choice, either to concentrate on the statistics or to immediately attend to some of the issues that would be affecting the health system functioning. This is a tough balancing between the academic rigor and to conduct this field research. In such situations, the scientific capital of the northern researchers may override the social capital of southern researchers. Thus, I think it's important to be more open and flexible to the research methods that could handle the unpredictabilities of the field. Unfortunately, developing world has been following the meta-narratives which are developed by the experience of the Western world, which may not actually explain the prevailing realities and may not offer the useful entry points in the system. So in this evening, I would call upon the scientists to invest more on rethinking the health systems from the global south perspectives. I would also urge to recognize the inequities that exist in the research collaborations, especially so in the north and south collaborations. I would like to applaud ITM for promoting our research collaboration based on positive social values such as mutual respect and trust. In this evening, I would like to narrate an incident to share how an expert from the northern world can influence positively a young researcher from South. I was invited a couple of months back by Government of India to develop a roadmap for leishmaniasis elimination in the Indian subcontinent. Professor Marlin Bullard from Institute of Tropical Medicine and few other eminent scientists from neglected tropical diseases were also present in that occasion. I was nervous because my expertise comes from HIV and tuberculosis. During the inauguration session, Professor Marlin came close to me and she whispered in my ears, "Look, Shree, many in this group may not understand the ground realities of Indian health system. You do your best in this workshop." You know, those words kept on echoing in my ears. And I not only did best in the workshop, I was able to put up a successful proposal for health system to eliminate leishmaniasis in the Indian subcontinent. Further, I have been called upon by Director General, Indian Council of Medical Research, to head the Indian Secretariat for leishmaniasis elimination in the Indian subcontinent. This journey was not easy. Me coming from a rural background, evolving into an international researcher, and to stand in front of you and address you is a remarkable progress in itself. This journey has been tough, especially being a woman, coming from a community where gender inequities prevail, including the field of research. I would say from my personal experience, I'm here, it's because of ITM's vision of North-South collaboration. I'm sure there are many deserving women out there in the South waiting for similar opportunities which could transform them into leaders in the field of research. That's why ITM has to continue playing the role of discovering and mentoring the future global health leaders. I thank ITM for giving me this opportunity to share some of my thoughts this evening. Thank you.
Hi, my name is Conor. I'm originally from Ireland, but I'm working here at the Institute of Tropical Medicine. My entire career has spent mainly looking at pathogens, where they come from, where they're going to, and using whole genome information to try to look at this. And I really think that in the future of global health, the things that are going to be important in the scientific community side is speed and information. And I think that using whole genome information especially can get us both of these things. For example, in diagnostics, we're starting to see the introduction of sequencing right there at the site of the hospitals, point of care, and patients. What you see is also for drug resistance, we're starting to see whole genome information being used for everything that's within the, it's moving faster than I thought it would. Everything that's within the genome in order to look at all drug resistances at once instead of looking just at drug resistances that happen gene by gene. And finally, we're also using it for tracking, looking at Ebola across time. We use it for looking for tuberculosis in Gambia and really trying to see how it goes from one person to the other, where it's coming from, and where it's going to. So I think as we go forward, the power of real-time sequencing is really going to change the future of global health as we're able to get all the information and all quickly. Thank you.
Good afternoon, everybody. I look at neglected diseases as a very complex puzzle that needs to be solved. There are too many pieces too many pieces, and we cannot move all of them. But this makes that the problem will be more complex. Here we have Judith. She lives almost 20 kilometers from the nearest local healthcare facility. She has a boy. His name is Jose, but everyone calls him Pepito. He has cutaneous leishmaniasis, and for 3 weeks, Pepito and his mom has to walk to the healthcare post to get treatment for his leishmaniasis. Treatment lasts for 20 days, and sometimes more, because leishmaniasis in children, it is more difficult to treat. After treatment, Pepitos might have to face with disfiguring scar. And as consequence, he might face discrimination. But Pepito's fate could be even worse. He could have developed mucosal leishmaniasis, which can cause lesion on his throat and cause respiratory problems, and sometimes can produce the death still today in 2017. But there is also an economic burden associated with this, because the time they spend in order to go to the healthcare post to get treatment is the time that Judith can work, and she cannot take care of her crops and livestock. The lost income because of it might put in risk their future development and also their basic needs. For example, in this case, Pepito's sister couldn't go to the school for the whole month he has been treated because nobody could bring her to school. Cases like Pepito and his family motivates me to work on getting the solution for this puzzle, especially in cutaneous leishmaniasis, which is highly prevalent in my country and affects thousands around the world. Diseases like leishmaniasis are neglected because they won't cause a prevalent mortality rates. However, they still will cause devastating effects on those affected by the disease and their families and communities. Also, these patients, I see them in my daily clinical practice. They come from rural areas, as the picture that you can see. Some of them, they have to work, to travel very long ways. They come from the highlands. They also come from the Amazon rainforest, and they had to endure very long journeys, not only in order to reach the local healthcare facilities, also sometimes when the cases are more difficult to treat, they also go to the capital. For that reason, I believe it is important to work together, to share and collaborate in all the sectors. If all the experts in the endemic countries work together, share their challenges they face, the success they achieve, it will be a lot quicker to put all the pieces together. We are trying to do that. We are learning and trying new things. We are learning from our mistakes and sharing with our peers from Asia, Africa, Latin America, and Europe. I believe that it is our obligation to let know and solve this huge and complex puzzle in order to bring and build a healthy world for our future generations. I believe that it is my dream, and I believe, and I'm pretty sure that it is also the dream of all of us. Thank you.